All right, welcome back to our Vidant Health Spotlight this morning. Very happy to have a good friend that stopped by. Never had her on the show before, I don't think. We've tried. We've tried. Janet Mullaney is the Chief Administrative Officer for Vidant Health, the health system here in Eastern North Carolina, which owns, I believe, is it 10 hospitals?
Actually, it's 8.
8 hospitals. Okay, good, yeah. And of course, people will remember Janet. If you may remember her from many things, but she was the interim chief executive officer for about a year before Dr. Mike Waldron came in.
Yes.
So, are you less busy these days, or?
No, I'm even more busier. No, Dr. Waldron is an absolutely joy to work with. We are so fortunate to have him in Eastern North Carolina. He's going to make a huge difference for healthcare for everyone, and I'm having more fun working with him than I have in years.
He's a great guy.
Yes, he is.
I've really enjoyed getting to know him as well. Also in the studio with us this morning, David Silver, who is a private practice attorney who specializes in advanced life planning. Good morning.
Good morning. Elder care.
Elder, is that the proper way to say it?
Yeah, elder care, part of it is advanced practice, but not everyone's ready to go.
All right.
So.
And you have a special connection to David.
Yes, I do. David and my late husband, Larry Graham, were law associates.
Who I knew and was a great guy here in Greenville, many years in Greenville as attorney.
And Larry was a certified elder law attorney and was the first one east of I-95 for years and years and years. And when Dave joined the practice, Dave developed an interest in Larry's work, and after Larry died, Dave's taken over his practice and is doing a fantastic job.
Now, we're going to be talking about end-of-life issues this morning, which is something that is not always comfortable to talk about, right?
Right.
Nobody really wants to talk about it, but everybody has to at some point. I know we've been through it recently in my family, and it's just something that, as a family you need to deal with, but sometimes it's very difficult to do that.
It's common for all of us.
Well, yeah, which is why guys like you make a good living. Because we have to rely on people like you to give us advice, right?
Sure, hopefully.
Yeah. And Janet, Vidant Health is doing some interesting things coming up on advanced planning. Tell us about that.
Yeah. A couple of years ago, we developed a work group to address advanced planning needs for our communities. And over the last 2 years, we've developed several tools and resources to help people before they're in the hospital have conversations with their family about what their wishes are, and also to help them support them in filling out the documents needed. And this has culminated into just hundreds and hundreds of people starting to do their advanced directives while they're still healthy, and we're very excited about that. And coming up April 19th at 6 o'clock at the Hilton, we have a physician who is a leader in this work coming down from Johns Hopkins, Dr. Macari, and he's doing a presentation. It's free. And after the presentation, there'll be a panel discussion, and if the attendees want, we can also help them do their advanced directives and their documents. So he is the keynote speaker. He is nationally known for his work, and we're very excited about him being here.
It's interesting. You've entitled this speaker series, "The Most Important Conversation We're Not Having."
That's right.
Which is true.
Yeah.
For clarification, David, let me ask you, what does advanced directive actually mean?
Well, advanced directives, it's when you are at the end of life. You're not coming out. You're not going to be able to communicate what your wishes are. And I call it the last gift you can give your loved ones by giving them guidance on these very difficult choices that they might be faced with at some point.
So, Janet, why is Vidant doing this?
Well, we learned years ago that 70% of the people say they want to die at home. However, 70% of us are dying in the hospital. And then we did a little bit more investigation. We realized only 25% of the population have ever had a conversation with their family and have ever completed their advanced planning documents. And when Larry was in the hospital, we have a blended family, and luckily Larry made sure all 4 children, his 2 and my 2 children, knew what his wishes were. And so because he died suddenly and he didn't he wasn't conscious, we already knew what needed to be done, and there was no conflict. And Larry used to say some of the saddest times in his profession was when he had to come in and deal with a family in conflict where children had a parent in ICU, and two children say, that's not what Mama wanted, and the other two children fought, and it tore families apart.
Yep.
And he hated that. And so that's why he encouraged me and everyone I know to complete these documents while we're still healthy before we have to be in a crisis situation. And that way we keep our families at peace with our choices.
That's great advice. And again, having just gone through this, so true, to have all of this done in advance. And David, when Janet talks about these documents, what do we need to do? What kind of stuff do families and children need to work on with their parents for end-of-life planning?
Okay. I generally like to tell people the will is the least important document because dying's easy. Anybody could die. The more important documents are the healthcare power of attorney. The healthcare power of attorney is a document where you're giving somebody else the right to make healthcare decisions for you if you can't make them. If you can make those decisions, and you make those decisions. If you can't, if you're out of it, then you're giving a designation of who's going to make those choices for you. And I like to have a chain of command. This person, if not this person, next person, not this person, next person. I always like to have backups. The next document is a living will. A living will is your communication directly to the doctor. You're saying, Doc, if I'm on one of these end-of-life situations, this is what my wishes are. And once again, that's the last gift you can give your loved ones by removing that burden of that very difficult choice.
And as Janet says, if you don't have that, it's left to the children to argue about what Daddy wanted or what Mama wanted and that kind of thing. But when you got that living will, there's no questions about it, right? That's a communication directly to the doctor.
That's true. And with Janet's situation, it had the potential even more difficult because with a blended family, if we didn't have any document, then the spouse is making a decision. Well, you have two kids from that don't have the same mother that might not agree with those choices.
Really gets sticky then.
That comes a big problem. So having a living will is very important to ease that transition.
So if you don't have a healthcare power of attorney, who makes the decision? If someone is in a situation where they're not going to get better, who has the power to make the decision to tell the doctor what the wishes would be?
Well, under North Carolina statute, the spouse, if there's a spouse, is going to make that decision. Now, if they're separated or they're not getting along, doesn't matter. Then if there's no spouse, then we go to a committee of parents and kids. So committee is definitely not a good way of making healthcare decisions. But let's say you're older, your parents are passed, but you have 3 or 4 kids. Every time a doctor wants to change a prescription or change the medication level, they have to make 3 or 4 phone calls. And then if you don't have kids, you don't have parents, then it starts to go out to other relatives, and then eventually it comes down to some guy down the hall.
And there's another document, too, a document called a DNR, which stands for Do Not Resuscitate. Talk about that document.
Well, a lot of people get that confused with the living will. The living will is the document where that's your time, you're ready to go, okay? The DNR is a document where, you're pretty much have to be in bad shape. You're saying if I were to pass, it would be a blessing. And if I were to fall over or hit my head, bring me back if you can. But if I were in constant pain, and I said, this is the end of I'm ready for the Lord to take me. That would be a time you'd have a DNR. Now, that is something that you don't do with an attorney. You do with your physician, and you had that determination. You have a talk with a physician, and they determine, are we going to bring you back or not?
Right. And Janet, on April 19th, all of this is going to be discussed, and people can learn more about it from one of the top experts in the country.
Yes, and Dr. Macri will focus a great deal on the conversation and how to have the conversation, how to make the decisions, and he's done a lot of this work, and this is a very difficult conversation if you don't know how to have it with your family, and so he helps, and he brings a little levity to it, and I think he will. People will find his message very, very inspiring.
What time does that start at the Hilton?
6 o'clock.
And it's free.
It's free.
So people should take advantage of it. Now, let me tell you, once I've been to someone like David and I've gotten all my advanced directive planning done, if I don't get it into the record at Vidant Health, it really hasn't done me much good, or it might be more difficult down the road. So how do you get all this into your records?
Well, we've been conducting these advanced care planning sessions all over Eastern North Carolina for the last year, and we developed a methodology where we can complete your documents, have a notary there, and we can scan them, and we can put them in your medical record immediately. If you don't have a medical record already with Vidant, it's okay. We can store them, and we have a registry set up, and if you come into one of our emergency departments, we can search our registry, and we'll have your documents. But Dave will probably tell you this, just as important that the documents, that you keep copies in your possession. You take the documents with you when you go to the hospital, even if the hospital has a copy. It's always good backup to take those documents with you and to share those documents with your family.
And this event, both of you are going to be available at this event as well. Are you both going to speak?
Yeah, we'll be panel members.
Panel members. And I'm looking at your notes here, Janet. Also, John Hill, the Reverend of Winterville Free Will Baptist Church.
Yes.
And Dr. Joan Lee, Vidant's Medical Director of Palliative Care and Hospice. And, of course, your guest speaker, Dr. Mackery.
Yes.
So April the 19th at the Greenville Hilton. I gotta tell you, I don't talk about this publicly much, but I've been through palliative care twice in the last 4 or 5 years with a family member at Vidant Health, and the job that you folks do there is incredible.
Thank you.
It really, everything is taken care of. The staff is wonderful, and it just makes it easy on the family. It's just such a difficult time.
Yeah.
And it's pretty amazing. I told my wife the last time we were in there, I said, it's amazing to me how well trained everyone is when you come to Vidant and you have to deal with losing a close family member, because the compassion is real and it's true, and you can really feel it. So I'd like to give you kudos for that, and all the administration at Vidant. Everyone over there does a great job with that.
Thank you very much, Henry.
Yeah. All right. Have we covered anything else that we haven't mentioned that you want to talk about that would go along with this subject? David, have I left anything out?
Man, you're asking an attorney to open-ended question like that. I don't know if you have that much time left. No.
You're not getting paid by the minute this morning.
Okay, then no.
Well, it's great to see you both.
Thank you.
This is a terrific event coming up, April 19th, Greenville Hilton, in the ballroom.
Yes.
One of the rooms there, somewhere in the back of the Hilton. And Janet, it's great to see you. Thank you for coming this morning.
Thank you so much, Henry. This has been a great opportunity for us.
Yeah. Janet Mullaney, the Chief Administrative Officer of Vidant Health, and David Silver, a local private practice attorney dealing with elder care. Thank you both. Great to see you, and good luck on the 19th.
Thank you very much.